Hey, so today I'm going to be talking about lymphoma. So the topics we are going to cover are: what is lymphoma, what are the types of lymphoma, what are the causes of lymphoma, what are the signs and symptoms associated with lymphoma, what are the treatment options available in India, and how do you identify the right hospital for yourself in India for the lymphoma treatment. So lymphoma is basically a cancer of the white blood cells involving the lymphatic systems. The white blood cells grow abnormally in number and spread throughout the body, specifically the lymph nodes, thus enlarging them and thus bringing down the immunity of the body, which is a classical understanding of the lymphoma condition. There are basically two types of lymphomas, the Hodgkin's lymphoma and the non-Hodgkin's lymphoma. The Hodgkin's lymphoma is basically because of the presence of the Reed-Sternberg cells in the lymphatic system, which cause the abnormal growth of the blood cells, specifically the white cells. DNA changes in the lymphatic system cause the white cells to convert into Reed-Sternberg cells. These cells further release cytokines which attract normal cells and form a cluster around them, thus increasing in size, and which is why causes the increases of the nodes, and the lymph nodes increase in size in the Hodgkin's lymphoma. What are the reasons for the Hodgkin's lymphoma? There are four main reasons. Firstly is the Epstein-Barr virus, which is the commonest reason for the Hodgkin's lymphoma. It is one of the glandular fevers, and patients who develop this ones are more prone to develop a Hodgkin's lymphoma. Secondly, patients who are already immunocompromised, like somebody suffering from HIV, will have a higher chance of developing a Hodgkin's lymphoma. Third is the family history. If somebody in your previous generations has had this, then there is a higher chance that somebody in the future generation is going to have a Hodgkin's lymphoma as well. And generally this condition is seen more in male babies as compared to other children. What are the signs and symptoms of a Hodgkin's lymphoma? The commonest symptom is development of lymph nodes in various areas like in the groin, in the armpits and in the neck region. These lymph nodes significantly increase in size. The other signs are fever, night sweats, being very exhausted and tired, not being able to concentrate. These are the common signs. Up and down fever, fever of unknown origin, which is again very confusing for doctors but is a very common symptom with Hodgkin's lymphoma. Loss of appetite and sudden loss of weight are also very common with the Hodgkin's. What are the treatment options for the Hodgkin's lymphoma? Firstly is chemotherapy, which is cytotoxic agents to kill the cancer cells. Second is immunotherapy to increase the immunity of the patient to fight the cancer. Third is radiation, which is given to enlarged nodes so that the cancer cells can shrink over there. And finally, patients who do not respond to such treatment or develop relapses, then stem cell transplant is the ultimate option, in which all the normal cells of the patients are killed and then new stem cells are transfused, which can be taken from the patient's relatives, generally called as autogenic stem cell transplant, and these new stem cells are then initiated to form new cells which are free of cancer. This is usually used for patients who are not refractory or not responding to the natural treatment or have developed relapses. Now, how do you select the right hospital for yourself for the management of this lymphoma condition? See, India has a very large number of doctors and hospitals with excellent infrastructure, excellent hematologists and oncologists that can manage this condition. But what you should specifically look for is what is the accreditation and the certification of the hospital, what is the infrastructure and the diagnostic facility available at the hospital, because diagnosis in such conditions is very, very important. Third thing is what is the expertise, experience and the seniority of the team, the hematology team and the oncology team in managing such conditions, what has been their previous success rates. And finally, cost is also a very important determining factor, because this treatment is a prolonged treatment and patients will need to set their budgets to see what suits them best. So these are the four important decision making factors when you select a hospital for lymphoma treatment in India. I hope I have given you sufficiently good information for planning your Hodgkin's lymphoma treatment in India. Anybody that you know seeks treatment in India or is suffering for something like this, please connect them with us and we will be very glad to help. Thank you.